So Tammy, I'm going to turn this over to you to introduce our guest speaker this evening. So please do go ahead.
Excellent. Well, good evening, everybody. I am super excited to be here and to be able to host tonight's session. I'm sure every single one of you know Dr. Austine. He's such an incredible doctor, MD, family medicine. And he's been with Max International as a diamond leader in the company, and he's doing tremendous stuff, just sharing his passion on bringing hope to the world through our products. And I'm really excited about your subject tonight, Dr. Austine, because I before Max International, I don't know if you ever knew this, but I had some fibroid issues. So I came into Max, got on the products. I never had these issues again. So it's interesting to hear what you have to say tonight. So thank you.
Wow. Thank you so much, Tammy. I'm so grateful and I'm so excited at the same time having this great opportunity once again to be presenting a talk on this second edition of Century Talk Show. Sincerely speaking, I was moved with passion to begin this mission to touch people's lives after I joined Max International and with the experiences I have had. And so far, I realized that the experience I have with fibroid is something that requires a lot of people to know, because it's so amazing that we have a company that can do what has not been seen to be possible. Because in the medical field, at a time, it was a difficult thing to achieve. That is, management of fibroid. They will tell you they don't know what is causing it. But in my experience, I was able to find one or two things. And for that reason, I decided to make it the second topic we'll be discussing on this wonderful show, where everyone in the world is privileged to be part of. And I want to assure everyone that is on this platform that this call tonight, that by the end, you'll be so excited and feel really blessed that your time tonight is not wasted. Having said that, I want to thank Chris immensely for giving this opportunity, because he gave birth to this idea. He brought about the idea. He conceived it and sold it to me, and I took it up, and here we are today with the support of Tammy. So presenting tonight with me is supposed to be Dr. Adebayo. He is a surgeon, but unfortunately right now, he's in the theater performing surgery. So as they say, life is forced. So there's no way we can ask him to leave the theater and come for this program. So we understand he's going to join us any moment from now. So before he joins us, let me start the program by discussing what we have today. And at a point, we'll be introducing a company to you. We've been silent about it up till now, but at a time we'll be bringing this, introducing a company to you that has played a role in fibroid management in the entire world. I never knew it's an issue in other countries as much as I'm getting to understand from what Tammy is saying. Okay, so to start with, it is important to define fibroid. At least you can see me. It appears I'm having some issues with my screen. Okay, all right. I'm sorry for that, okay? So now, it is important we know what fibroid is. Medically, how do we define fibroid? Fibroids are abnormal growths that develop in or on a woman's uterus. Sometimes these tumors become quite large and can cause severe abdominal pain and heavy periods. In other cases, they cause no signs or symptoms at all. The growths are typically benign or non-cancerous. The cause of fibroid is usually unknown. Now, to explain further, you know, what the womb looks like, I usually like to use pawpaw as an example. If you know pawpaw, you know it's made of, the structure is like that of a flesh. We want to call it the fleshy part. Yes, fruits can be fleshy, yes. I hope you'll agree with me. I was beginning to think it's meat that can be fleshy. So fruits can be fleshy, actually. So when you look at pawpaw, you know it has a space within it, and it also has the body parts and the entire surface outside. So let me show you something. I don't know why I'm having issues with my screen. I can't get my bigger screen up now. I don't know what I did to it. Just a moment, please. Okay, I've solved the problem. Thank you very much.
Beautiful.
So I'm going to show you what it looks like, and I'll be doing that on my background, so you know what the fibroid looks like as it exists in the womb. Just a little more time, okay? I think I have it now. So as you can see on the screen right now, I hope everyone can see it. If you can see it, just type a Y, yes. Now, this is a typical, thank you very much. Now, this is a typical, you know, description of what a fibroid looks like. It can occur on any part of the body of the womb. Now, when it is located at the upper part, you call it fundal. Sorry, not fundal, it's called subserosal because it's outside. And you can have subserosal in any part of the body as long as it's located outside. Then you have it growing within the structure. Remember, I was trying to use pawpaw, you know, as an example. Now, looking at this, fibroid can be growing right within the flesh, you know, the muscle of the womb. That you call intramural. And when it is bulging inside the womb and a thin sheet covering the surface of the internal part of the womb is only what is preventing it from getting inside the womb, we call it submucosal. And we also have the one we call pedunculated fibroid. Now, the reason why this is very, very important for us to discuss is this. There have been a lot of misconceptions, and by so doing, people are exploited from certain experiences with those who claim they can manage fibroid. You'll all agree with me that there are traditional practices about managing fibroid, especially the use of herbs and all that. And one common experience or common testimony that people usually give is that they actually use someone's medication and they passed the fibroid out of their womb or while having their menses. Okay? Now, I want to explain something to you. If you are seeing my, if you are seeing the screen right now, this particular pedunculated fibroid, okay, is the only type of fibroid that can be passed, you know, out. I hope you're following. Is the only type of fibroid that can be passed out. And I can tell you less than 5% of those who have fibroid have pedunculated fibroid. So it's quite unfortunate that when somebody is given some treatment and the fibroid is passed, and you show it as an evidence, you start telling everybody that fibroid is passed. For crying out loud, as you can see, there is a thin segment. Unfortunately, you cannot see my cursor pointing at anything, but you will see a thin stump that is attaching the submucosal fibroid to the internal part of the womb. Now, something can happen to this segment. The fibroid can twist. We call it torsion. And when it twists and it torses, you understand, the supply to the fibroid is cut off. And when the supply to that fibroid is cut off, the next thing that happens is the stump goes dead. The fibroid itself goes dead. Blood supply stops flowing and it begins to degenerate. At that point, such women having this kind of situation will be in severe pain while the process is ongoing. But after the disconnection, in other words, the point has cut off and there is no more connection and healing has taken place, the fibroid, the pain stops. But this fibroid element remains in the womb. And over time is going to be passed out, because whatever is in the womb, there's always a natural process by the body to push it out. I hope we do understand. If you are following me, please type U. That means understand. Okay? I want to be sure you are following me. Now, it is quite unfortunate, like I said, for you to use this as a reason for an evidence that a treatment worked. We have had so many, statements, claims about fibroid that, things that is just because they don't understand the nature of what is going on. Now, there's no amount of thing you want to do to make this fundal submucosal come out through the body. Is never possible. There is no amount of treatment you want to do to give to somebody that will make this intramural one or the subserosal one come out. So I'm saying this so that from henceforth, if you're on this call and you hear somebody said, I used someone's medication and I went and passed the fibroid out, you are more knowledgeable enough now to understand that this is what happened and you cannot be tricked into it. If that person has just this fibroid alone, then the person definitely has taken care of a fibroid problem. But just in case the person has multiple fibroids and this is one of them, then it means this is the only one that fell off. Then it's also important to know that fibroid is such a substance that can behave anyhow. It can become anything. Medically, we know that anything can happen to fibroid at any time. It can degenerate. It can become cancerous, or it can continue to become tumor. And there are conditions that can affect the fibroid. Now, what are those conditions? Because physiological state of women, varies a lot of times. It's only men that continue to have a single physiological state. But women are like seasonal people. Their conditions vary according to hormones in them, okay? At a time they are menstruating, their body system at that point is different. At a time they are pregnant, their body system at that point is different. Now, all those conditions affect what is happening to the fibroid. At this point, it's important I let you know that there are two hormones that are released by the ovary. As you can see, the ovary, we have one on the right and one on the left. They produce estrogen and progesterone. This estrogen and progesterone are responsible for the development of the reproductive system, the maturity and the function, like the monthly periods and also ovulation. Now, if you are looking at this womb, you see the lining of the wall of the womb. This lining of the wall of the womb is called endometrium, okay? This endometrial lining is what you wash out every month as blood if after ovulation, sperm does not meet the egg, okay? So if something happens and sperm meets the egg and there's fertilization, that means, what I mean by egg is ovum, okay? And there's fertilization. Fertilization usually takes place at the tube. If you look at the tube, though the means I'm using to do this presentation will not allow you to see the cursor I'm using. But you can see the uterine tube is somewhere at the midpoint that the sperm meets the egg, and the egg travels straight down into the womb. And once it gets into the womb, it implants, okay? The egg is usually released from the ovary. And as it's released, you can see this funnel-shaped structure. This funnel-shaped structure is called the fimbria of the tube, the uterine fallopian tube, okay? This is the fimbria end. Sometimes they are like broom. The way it is drawn here, you may not appreciate it. It's quite longer. It's like they've trimmed the edge of the sheddings, you know, from the tip. So now, once egg is released, it is absorbed and it comes down into the womb when it is fertilized. But when fertilization has not taken place, the egg continues to stay in the womb. The moment it dies, then the growth of the womb that had already taken, the growth of the lining of the womb that was being controlled by the hormones I mentioned, will begin to degenerate too. It's like we used to call it the weeping of the womb. They are weeping that they have lost another opportunity to get pregnant. So that process, you know, reoccurs every now and then. And in the process, if you have a fibroid like pedunculated one, the attachment of that fibroid could go with the menstruation and someone could pass the fibroid out. So having said that, the question we want to ask now, because our time is limited and we'll give the rest to you as an opportunity to ask questions, because some of you may have questions to clarify on this show. Now, one question is, why are ladies? Because usually fibroid occurs in women from the age of 30, okay? But these days, we are seeing young ladies, young girls below 30 years having fibroid. And unfortunately, their fibroid is usually very, very large. I've seen a year of 24. I've seen a girl of 24 years, a girl of 28, you know, having massive fibroid. You think she's probably 6 months pregnant. So why is fibroid so common these days? Here is the reason. You probably will not hear it discussed, you know, elsewhere. The diet we consume encourages the growth of fibroid if you're a woman. Because remember that our diet sometimes is filled, we have much of these agricultural products. When you take protein, let's say for instance, chicken, turkey, and all that, they are injected with some things to make them grow well and all that. There are some hormones that are given to them to make them grow big and things like that. So if you consume so much of all those stuff and you are taking hormones, it could encourage the growth of fibroid in you. Of course, we also know that milk products is also from agriculture, maybe from cows. Yes, basically cows. Cows are the ones that usually produce milk. Now, when you constantly take milk, this is like I'm revealing some important secrets to you. As a young girl that is quite growing well and you're quite fertile, your system is very fresh, and you are given to taking milk, you're likely going to be growing fibroid if the tendency is there. Of course, we will also know that other risk factors include genetics. We also have, if you have any parent or any sibling or any relative that has fibroid, the chances that you have fibroid is quite there, okay? So I believe you understand now why young girls these days are coming up with a lot of fibroids. We also know stress these days is increased, and the more stressed you are, the more tendency you have to, as a woman, to develop fibroid or other cancerous situations. So having said that, I want to touch on the symptoms of fibroid. When you have fibroid, what are you likely to experience? The first thing you are likely to experience is excessive bleeding. You might be bleeding more than what is normal for you. The bleeding might be heavy, and the number of days while menstruating for you may be longer. So that is the first sign that you might be having fibroid. You may be having low back pain. You may be having lower abdominal pain. You may also be having menstrual pain. Whenever your menses are coming, you start having pains, okay? Then also your urination may increase. You may just notice, okay? You may just notice that you are urinating more frequently. If you're urinating more frequently, just know that it's possible you are growing fibroid. Of course, there are other conditions you have to rule out. You have to be sure that you are not having high blood sugar levels, which we call diabetes. You also don't have bladder infection. And here is the reason why you're going to be urinating more frequently as a sign. If there is no infection in your bladder and we're not dealing with diabetes. And the reason is this. The urinary bladder is lying on top of your womb, okay? And the bladder is expected to fill up to an extent that after which it can't take more, then the urge to urinate will come. So if you have a womb that is carrying heavy load, like fibroid, the space the bladder has will be reduced. So if it used to take like 5 hours to fill your bladder, you may realize that and maybe the volume of your bladder is 500 mils. If the size of the womb caused by fibroid has reduced your bladder volume to like 250 mils, then it means that every 2.5 hours, you're going to be voiding. So that's an explanation for that. Then having intercourse, painful intercourse, you know, you're having pains during intercourse, it may suggest that you are dealing with fibroid. All right, some might just be feeling heaviness down. They don't know what is there. Some will say they feel like it is stone. Then the most common observation that you get when the fibroid has gotten to more like the extreme stage is seeing your abdomen very big. So having said that, how do you manage fibroid? Surgery is usually advised at some stages, but before surgery, if the fibroid is quite small, it is as advisable that you use, you see your medical doctor, let him advise you, let you get investigated. And me being a family physician, I'm trained to kind of assess you as a whole. So assessing you as a whole means I'm going to assess your stress level, know if you are going through difficult situation, check your diet, what are you eating, you know, do you take too much of, you know, beverages, drinks, and all that? Because all those things could be contributory to development of fibroid. We also have alternative care. It depends on which culture you are from. Some people do yoga, some people do massage, and a lot of stuff. But I want to tell you at this point that I have a very peculiar experience with the care of fibroid in the last maybe 5 years. And like I said earlier on this show, that was what actually prompted me to want to present it, you know, because if you have a solution that is working and it is doing that amazingly, you want to tell it out to people. So, and that came to be when I joined the company called Max International. Of course, you heard the testimony from Tammy a while ago that she used to have issues with fibroid, and after using the product, her fibroid disappeared. We never believed such a thing happens. By the way, a lot of people parade supplements as something you can use to cure or manage fibroid. But I want to tell you, a lot of them are telling lies. And that's the reason why medically we do not believe in that. But with the experience I have with Max International and their products, I found out that, you know, a new solution has come to the care of management of fibroid. I will tell you a case in the hospital I had. A woman actually had fibroid, and for that reason, she could not give birth. And I introduced the product to her. Of course, when we talk of management of fibroid, we do not stress the use of a particular product. It has to be a kind of system of management. There are a lot of other things to include in whatever you are doing. You don't just pick. What I'm telling you in essence is that I didn't just pick the supplement alone and ignore other things I should do. So putting all things together, I got results that I wouldn't have gotten if I had not added this supplement. And lo and behold, magical things happen. But it took so long. I had many testimonies about how this was working for fibroid before I personally had my own. So at this point, I would like to invite someone that I respect so much that introduced me to this great opportunity. He brought it to, I would say he brought it to Nigeria then, because he was the one that I know. He brought the opportunity and was able to convince me to try it. And when I tried it and got this experience, it became, a life changer for me. So before I proceed to tell you some more about fibroid, for instance, issue of fake operation, issue of fear of surgery, I'm going to tell you certain things about that. But that will be after I've gotten this we have had this presentation from a mentor of mine, someone I respect so much, someone that has changed my life, and he keeps training me. Recently, he trained me on how to do some flyers, and you'll be surprised that the outcome was quite amazing, and the training was just more like overnight. So it is my pleasure to introduce to you our great crown diamond, Chris Gingras, to take over from here. Thank you very much. I don't know if Chris is there.
My apologies. I was talking to myself.
Okay.
Yes, I was saying thank you so much for this wonderful introduction. And you know what, Dr. Austine, working with you, it is a privilege. I mean that. I really, really mean that. And this is what I'm so impressed with, is the kind of professionalism that we attract to really share this with their patients, but also not just their patients, but people in general. And one thing that what Tammy and I are about to share here this evening is not designed to cure or diagnose any diseases. It is designed to complement your nutritional habits by providing you an environment for your body to do what it was meant to do, the way God created us from birth. And I'm telling you, when you feed the body with proper nutrients, it is amazing the miracles that happens within our environment. And I know that Tammy shared a testimony at the beginning. And Tammy, while I switch the screen and I get into sharing people some visual, do you mind kind of sharing briefly your story as to how things has evolved with you? Because I remember you were dealing with some serious pains, and as listening to Dr. Austine and some of the symptoms that he talked about, you went through some challenges too. So I'll turn this over to you as I prepare the screen for everybody.
Yeah, and at the time, Chris and I weren't, we were just kind of at the beginning of getting to know each other. And, but I had always, even young, I always had issues with heavy bleeding. I have two sisters as well, same thing. All three of us had challenges with that. And the cramps were like really, really, really bad, and didn't know that it was fibroids. And one time I was rushed to the emergency, and I was folded over in pain, only to find out what fibroids were. And so it was, and later on in life. And anyways, when I started to take the Max products at the beginning, I was so surprised because my periods at the time had lightened up. The flow wasn't as much, but more importantly, it's the pain started to go away. But I still had the doctor that would keep an eye on it, and it was shrinking, and next thing you know, it's gone. So I know that it's worked tremendously for me, and I know what it feels like, and it's not a pleasant feeling at all. I've had two children, and it is worse feeling than giving birth. That's how painful it is when you have fibroids, especially when they're that big. So yeah, and I didn't even have to have surgery. So I was excited about that.
Thank you, Tammy. Really do appreciate that. And just to kind of give you an overview, I'm not a medical practitioner. I'm an entrepreneur, but I have been listening to doctors for the past 15, actually almost 20 years now. And at one point, you can't avoid by learning. And one of the things that we want to talk to you about is this big mouthful of a word called glutathione. And glutathione is really the compound in your body that sits in every single cells of your body. In fact, I'm just amazed that many, many medical practitioners have never heard of the word glutathione when it's such an important commodity in the human body. And what it is that it lives inside the cells. And as we age, from the age of 20, the production of that molecule decreases over time. But it will get worse with nutritional environments, toxicity. You know what I'm talking about. Just by driving your car and breathing the fume from cars, it's unfortunately, all of these things are very, very harmful to the body. And that doctor I'm about to introduce created this patent called ribosine that's been patented. And this particular ingredient came to trial and error, where he was actually dealing with people that had liver issues due to alcohol, drinking, and all sort of situation going on with issues with the liver. And what happens is, as he started discovering different kind of recipes to try to clean the liver, then he came up with this patent, this actual product, this compound called ribosine. And this ribosine is the ingredient that the body will recognize to do the most important, to create the most important molecule in your body, and it's called glutathione that you saw earlier. This doctor, Dr. Herb Nagasawa, is a Japanese doctor that actually was raised in the United States, and he created something that can actually change the world, and it already has. It's because of him that we are in 18 countries sharing this technology worldwide. It is very, very serious. And very quickly, these products are certified halal to make sure that we respect all of the different religion cultures, and to make sure that there's no pork and things like this. The capsules, they're not gelatin made from intestines, but it's actually made out of plants. So Max International has such a high rate quality of high-end product. It even has a label called Banned Substance Control Group, which is designed to confirm that these products are not contaminated and they contain exactly what the label says it contains, and there is no illegal substances in there for professional athletes. And I also I cannot forget, I wanted to mention this wonderful lady by the name of Justina. Tammy and I met her at the airport in one of her trips to Nigeria, and she's the one that introduced this to Dr. Austine. And Dr. Austine, such a powerful, powerful, influential doctor, have made such an impact in educating the world. So just a thank you for introducing us to Dr. Austine. And I just wanted to kind of recognize that. Now, folks, as I continue here very briefly, I'm just going to touch on some of our products here so you get an idea on what we're talking about. I do get back with Dr. Austine or the person that invited you to this webinar to get more information, because I'm telling you, you will not regret it. This particular product over here is called Selgivity. That is the product that we're talking about. Ribosine is the one ingredient that we're telling you about, and it's also supported by 12 other supplemental ingredients, basically aloe extract. Aloe is recognized to heal the burn and the skin. Well, at the cellular level, when you consume that, it has incredible healing properties that will compare to the ribosine. That's two ingredients. There are 13 ingredients in this particular product. And I do recommend you get back with a person to give you more information. We got brochures, online brochures, we got videos, we got thousands of testimonials from all over the world with this. And very quickly, we have the max ATP. It's also fueled by ribosine that is designed to replenish, to deal with fatigues. Many of you work long hours and you're tired. You'll be amazed on how you will recover by taking this wonderful product. Neutralizes free radicals in real time. It is phenomenal if you happen to be a trainer, or if you happen to be sick, or if you happen to be a bit older, or if you happen to be, having chronic fatigue. Phenomenal product to complement the Selgivity. This one here is a max infuse. And again, I'm giving you a quick summary here to respect the time that Dr. Austine has to share with you. It's a very, very important topic. But these products will help you feed and complement your efforts in dealing with a better quality of life when it comes to product use. And the infuse is so important because, as Dr. Austine was sharing with you earlier, a lot of our basic food today do not contain the nutrients that used to be. And if they do, it's full of pesticides and lots of things in there. Tammy and I bought a machine that cleans pesticides from the water. Could you imagine? The water turns yellow once we put it in there. Why am I telling you this? It's because our food is contaminated by the environment that we're exposed to every single day. Supplements are not a luxury anymore. They are a necessity for survival if you want to live a good, healthy life as you mature in time. So this is a wonderful supplement. There's 15 servings or 30 servings, depending on the products that you want to use or the amount that you want to consume. And it contains important direct and indirect antioxidant. It supplies important vitamins and nutrients. It supports enhanced glutathione function. As we're telling you, glutathione is so important. If the glutathione in your body is higher, the inflammation is lower. What we found is when the glutathione is lower, inflammation increases. When inflammation increases, your body gets in trouble. But inflammation reduces, your body's in a better state to heal, and that's what's so important. And the Meta Switch, this is a wonderful product to lose weight. It's a product that's been recently introduced in Nigeria, and it's phenomenal, created by Dr. Moad, that is designed to assist your metabolism in achieving the desired weight loss, right? Promote the regular glutathione production. And why does it have ribosine in there to support glutathione production? Because when you start losing fat in your fat cells, there are toxins released back into the bloodstream that will again contaminate the body. So it is designed to, as you melt the fat, to neutralize the free radicals. Does it compare to Selgivity? No. The Selgivity, that's the one that is very concentrated. And we have other products that are very highly concentrated to help you produce more of the precursors to elevate the glutathione production. And the last product I'm going to talk to you about, which is really important for cardiovascular, for your brain, your eyes, your nerve functions, your hair, your nails. This is called the Omega Max 357, which is a combination of blends of oil that are extremely important. And again, we have more trainings for you to get a better understanding of what this is all about. So Dr. Austine, I'm going to turn this to you, and I want to thank you for giving me the opportunity to share this wonderful moment and providing information on our products. So thank you again for the time you're spending with us. So I'm going to call the call over to you.
So Chris, thank you so much. I'm so grateful. I can't thank you enough for always being there for us, to give us the support to do such great presentation, touching the lives all over the world. So having heard from you, I want to continue from where I stopped, and I want to make it brief so that we can get to the question and answer session. As I can see, a lot of people or some persons are beginning to answer their questions. So when you have your questions you want to ask, please start typing them. I believe Tammy will be taking note of that and will address that session as soon as I'm done. And I'm going to make it as brief as possible. Okay. Now, there's what we call scam. Scam happens these days in almost everything. If there's an area where people are emotionally affected or people are disturbed and it appears solutions are not forthcoming, just expect that there's going to be scam there. And I want to tell you the nature of scams that are taking place in this field. By the way, if doctors were not sincere people and people of integrity, they would have been scamming people too. And here is the way they could have done that. There are drugs, we call them gonadotropic releasing hormones. They have a way of suppressing the growth of fibroid and making it shrink, but it's only temporary. When you take such drugs, the fibroid begins to reduce in size. In the past, in the aspect of surgery, where we have very huge fibroids that we know even the surgeries can be life-threatening. Such drugs are usually administered for about 2 to 3 months to get the size of the fibroid reduced. And once the fibroid is reduced quickly, they jump into the surgery, remove the fibroid, and the person is fine, okay? That is what happens in the medical field. And here, there's a reason why you cannot continue to use such drug. Is because it has some bad side effects, okay? So I want to tell you that there are people who will tell you they have some things that work for you, and they would have, they could make some herbs. I've seen where in a church, a pastor was dissolving CPZ, a psychiatric drug that makes them calm, and was claiming he can cure mad people. He puts it inside water. And once they come to the church, he prays for them, and give them the water to drink. And once they drink, the next thing, the person goes off sleeping. And before you know it, you know what psychiatric drugs does to people. They are calm and they say, no, this pastor is powerful. A lot of terrible things are happening. If you stay with me in the hospital, you see terrible things we hear, and we begin to imagine, really, could this really be happening? There was okay, you could use, so that I don't disconnect, some people could use some of these drugs, include it in whatever they claim is working. Just for the meantime, they tell you, go and do scan, and after you've taken their product for 3 months, they ask you to go and repeat the scan. Once you see the fibroid has reduced, you say, wow, and that's a big market for them. And before you know it, but guess what? In the long run, the problem still remains there. And people are wondering what is really happening, okay? I want you to be beware of such scammers. Then there is this fake operation. There was a day a lady came to me with a very huge fibroid. And what happened was she had presented in a hospital. I wonder what kind of hospital that is. Sorry, I'm seeing some posts here. Is it deliberate? Okay.
Chris, you have another screen on? There's something else there?
No.
It appears somebody is posting, having
on.
access to the screen.
Hold on there.
If you can identify that person, I think the person should be blocked. You can imagine we're talking about scam, and look at the nature of scam that appears to be going on right before our eyes here. Somebody trying to dupe people.
One moment.
If not, I don't see a reason why you should be.
I apologize. I'm not sure why this happened. I need to control this.
Okay.
So my apologies. Go ahead.
So whatever it is, now the lady came and wanted operation. It came through a particular church. By the time I assessed her, did a scan investigation, she had this huge fibroid mass that was touching her lungs. It was so huge that it was touching her chest bone and her lungs, preventing her from breathing well. But guess what? They claimed they had done a surgery about a year earlier in a different hospital, and the fibroid was removed. I asked, how was the surgery done? There was no, they said they took her in, made her sleep, and did some kind of surgery on her, but knife didn't touch her. So I said, knife did not touch her, and you still believe surgery was done on her? They say yes, because they saw the evidence. That picture was shown to them of the fibroid that was removed. But lo and behold, after asking them to bring the picture that was given to them, the man brought it to me. When I saw the picture, it was a picture of a total womb removed from another person. And this was what was sold to them as the fibroid that was removed from her. So you could imagine that even the person that was giving them that picture and that did the surgery for them don't even know the way fibroid looks. For him to be given the picture of an entire womb. So the fibroid still remain there. We see all sorts of things. This one happened right in my hospital. Okay, so having said that, I want to address one critical issue about fibroid, the way I handle them in my facility. When people come and they have issues with fibroid, this is what we have to do. First and foremost, they need to do ultrasound scan. And that is the way you can diagnose fibroid. It will tell you about the size. And the size is very, very important. Now, with the size, you can determine what to use for the management. Now, if you have very small fibroid, it is not advisable you go for surgery. This is where you really need supplement. And that's why I needed Chris to talk to us about this wonderful product that is working very well. There was a day a lady came to me in the hospital requesting to do surgery of her fibroid. She said she was with a different doctor who told her she would have to operate the fibroid. But she knows the history of my hospital, so she wants me to do the fibroid. And when she got to me, I assessed her and I found out that the fibroid was so small. The surgery will harm her at that point. And it's such a fibroid that actually cannot prevent pregnancy. I hope you know that you can have fibroid and at the same time still be pregnant. If you can flash your mind back to the screen, picture of fibroid that I showed you. Fibroids that are touching the inside of the womb are the ones that actually prevent pregnancy. Except if the ones outside have grown so big to the point that they are compressing and taking over the entire structure of the womb, which is also possible. That can prevent pregnancy. But if the fibroid is small and it's not anywhere near the womb, you can still get pregnant, okay? So it is not all fibroids you go operating. So having said that, I need to tell you about the fibroid that must be operated. We have fibroids that are as big as the size of a football. So tell me, what supplements do you want to take? Even if it's going to shrink it, it will hardly shrink it beyond half of the size. And if eventually it's going to shrink it completely, then such shrinkage should be expected in maybe 2 to 3 years' time. And who is ready to continue to take supplements for 2, 3 years? Nobody's ready to do that. So I advise people to actually see the experts, let them give them the right assessment of their state and what is best for them to do at the point, okay? If the fibroid is small, you go for supplements. If it is moderate and you have the time, you can still go for supplement. It does work. But mind you, there are other factors that will need to be taken care of. For instance, you are going through some stressful situations, your diet is just anything, you are not living healthy, no exercise and all that, and you want supplements to do all the job while you continue to live your life the same way, I'm sorry, you're not going to get the results that you're looking for. This is quite important for you to know. You see, sometimes some persons will say there are some things you do that give results. It's not a surprise that there are some therapists, psychotherapists, those who can manage your emotions, manage your stress, give you some massage, anything you can do to help somebody release stress. It can also contribute to tackling your health challenges, of which fibroid is one of them. So at this point, I want to draw up the curtain to my presentation and give opportunity for those who have 1 or 2 things to clarify. Please feel free, whatever it is. you want to know about fibroid, feel free. I just can't tell you everything. Okay? Thank you very much. Over
Well,
to you, Tammy.
yes, Tammy, if you can kind of go through some of the questions and read them to Dr. Austine for him to answer, that'll be wonderful.
Absolutely. So, somebody mentioned that their first fibroid surgery 18 years ago, they had 2 C-sections, I think. Is that what it is, CS? And I did an embolization on the fibroid in 2016. Now the fibroids have calcified, still big and resting on some organs, as the last scan in October 2021 shows. Can the products that you're offering get rid of these fibroids, considering my history?
Yes, very good question. You see, first and foremost, it's important that I want to give you one important information to help you understand what is happening. Now, usually when fibroids occur, if it is just one, you are lucky, but it hardly comes as one. They come in multiple, numbers, like 2, 3, 4, 5. The last surgery we did in my hospital, we removed about 39 fibroids. I did that with Dr. Adebayo. We're supposed to hold this. The reason why I even wanted him to be part of this presentation was we do fibroid operation together, okay? So, and I know he would have something to tell us about fibroid with his vast experience. Now, fibroid, when you take them out after surgery, because there are various sizes, surgery can only handle what human eye can see or hands can feel, okay? The little ones that hands cannot touch or eyes cannot see will be left, and they are bound to grow back. So that's the reason why I place all my patients after fibroid surgery on this product, so that it will suppress the little ones that were not removed. Because a lot of people have done surgeries, and after a while, give it some months, the fibroid is grown. Medically, doctors, surgeons will advise that, madam, we have operated you, this fibroid is likely to grow. So before it grows back, please get pregnant as soon as possible. Otherwise, the fibroid will be back. So everybody that has fibroid needs to take products that will suppress the fibroid. So even the fact that you do surgery is not a reason why you think you don't need to take supplement, okay? And that's the more reason why when they come with small sizes, I prefer not to talk of operation. Let them just go for the special products, the supplements that will help them suppress the fibroid. Now, I can tell you, for this person in question, if you use the product, it will help you with your fibroid, okay? But you also need to address some other health issues. Do not hang everything on the supplement. Try to live healthy, because everything works hand in hand. And if you have the opportunity of probably getting in touch with you or your upline, if you are an associate, I would like to educate you more on it, because there's a lot I can say on this platform that will help you manage it. So it's a yes, it's going to help you. But like I said earlier, fibroids are funny. Some can decide to become cancer, some can decide to remain the tumor, and they respond at different rates. If you have 2 people with fibroids and they are using the same thing to shrink or eliminate the fibroid, they are not going to get the results at the same rate, even if they have the same size of fibroid. This information is very, very important. While somebody is getting her fibroid resolved in 2-3 months, the other person could get it resolved in 1 month. And it could also take up to a year for that person to get her fibroid resolved. So that's why when I'm discussing issues of fibroid supplement and the person is only willing to take the treatment for just 1 month, I'm worried, and I don't want to go into business with that kind of person, having them, because they'll come back after 1 month and tell you the fibroid is still there, it hasn't gone. So this information is quite important. Thank you very much. I hope that answers the question.
We have another one. People were asking about which product do you recommend when somebody has fibroids?
Okay, the number one product I recommend when somebody has fibroid is Selgivity. You can combine it with meta switch, because fibroid obesity or overweight is also linked to fibroid. When you are overweight, we still have fibroid in skinny people, okay? That does not rule out the fact that when you are overweight or fat, you have more tendency to have fibroid. So if anything you use, you can go and Google it. Anything you use for weight management can also help you with fibroid. That's why I will advise you use Meta Switch in addition, and using a 357. That's Max 357 is very, very good for you. So these three combinations, but because of the cost, you may want to, go with Selgivity, but if you have more resources, you add 357. And if more, either 357 or Enfuse. Sorry, Meta Switch. Any of them can go with Selgivity. But if you can afford all of them, it's the best. That's it. Thank you.
Excellent. Thank you for that. And we had one question in regards to, even if somebody has small fibroids, should they be taking the Selgivity?
You see, I love Selgivity so much because I think I don't want to be too loose with my words. But I can almost say that if you do not have fibroid and you are taking Selgivity, there is no way fibroid is going to come. No way. I don't see how fibroid is going to come. You understand? And if your fibroid is quite small and you take Selgivity, personally, I've witnessed this one. I've witnessed this one with small fibroids. You take Selgivity, the fibroids wipe off. Okay? But the challenge we have is with the bigger ones, because when things grow, they begin to lay down some tissues that tend to make them difficult to resolve. You heard someone mention about calcification, okay? When you say calcification, it means it's a part of it is already becoming bone. You understand? It's becoming bone, and it's usually at the central point of it. So when fibroid has stayed long enough, it is drifting towards bony structure. And that's why you hear the word calcification. Calcium has gone in to react with the substance of the fibroid, making it become bone. Definitely, you're not dealing with an easy fibroid. So the answer is yes.
Oh,
Now,
thank
Tammy,
you for that.
you might have
Go
skipped
ahead.
Gabrielle. There's a really good question there that may require a bit of help. Just above Patty's questions in reference, some people are having a hard time sleeping, and I have a great
Yeah,
answer for that, but I would love Dr. Austine to take it.
Yeah, I was just going to get to that because I didn't know if that
Wonderful.
was fibroid related, but they were talking about should they be diminishing the Selgivity? They have a client on Selgivity that's having difficulty sleeping. That's the big question.
Okay. If you have someone on Selgivity and is still having difficulty sleeping, I think the person probably is just, there are some things that needs to be discovered about that person that are not known yet. And that's the reason why I don't just place people on Selgivity. I want to test them for something to check. Because I'll give you one instance. When you have heart failure, if it's a chronic heart failure, one of the things you're going to have is difficulty sleeping. And if you decide to take Selgivity, Selgivity is not something that works overnight in a heart failure situation, because the structure of the heart will need to be transformed. You know, the fibers will need to be strengthened, remodeling needs to take place, and it takes a while. So heart failure, Selgivity will not just take care of it. I had a patient with heart failure that came from Gabon. That was about 6 months ago. And she was placed on a drug permanently and was told that if she stopped taking this drug, she was going to die and her problem was permanent. Okay, so eventually she got to Nigeria and ran out of her medication and she began to panic. So they brought her to me. Of course, there was no access to go back to her country immediately. So she felt like she was going to die no matter what. So I managed her. The regimen I placed her on was Selgivity and a few other things, okay? So I want to tell you now, this lady is cured of her heart disease, permanently cured. I got a word from her a few weeks back. She's still okay. She's not taking any heart drug. And I've also managed a psychiatric patient who was dependent on her psychiatric drug, and she was turned to somebody else, okay? And after taking these products, I've always used Selgivity with some things. I'm not going to disclose that to you, but yes, some other products with marks, but I also have some other things that I add. You know, I'm a professional. I know what to do to get the best results, okay? This person was weaned off her psychiatric medication, and she doesn't have psychiatric symptoms anymore. And it was a miracle. In fact, this person was telling me that the regimen I gave her was functioning in 2 dimensions, was functioning in the spiritual dimension and the physical dimension, because some spiritual attacks she was getting appeared to be taken care of. Those who were gluing to her, you know, giving her some spiritual problems and all that, started giving her space and all that. You get it? So we can go on and on. This is just an eye-opener. So back to the question. If you are taking Selgivity and you are still not getting sleep, please investigate yourself properly. Now, if for instance, Selgivity is not a license for you not to do exercise. Now, if your life is so sedentary that nothing like exercise is part of your deal, and you want something to take to give you sleep, I'm sorry to disappoint you here. Selgivity won't give you that. Okay? So with other things. So you need to check yourself. If there is a plug to fill, a space, a pothole to fill, please do that. It's just like counting on cement alone to build a house, because cement is so powerful and you think sand or water should go away. Life is not like that, okay? Selgivity has come to play a wonderful role, but it has not come to take the role of other things. I hope that is clear. Thank you very much.
And Tammy, if I may just step in here in reference to Prince Ray, what is fibroids? My recommendation, this call is recorded. It'll be posted and it'll be available to all. So not to worry about it. You can just listen to it and you'll get all the information. Okay. So it's just for the sake of time, because we do want to finish this at in about 10 minutes. So please go ahead, Tammy, continue.
All right, so we have another question here. How long can I take the products, and given the fact that I have huge multiple fibroids?
You have huge multiple fibroid. I'm not here to appeal to everybody to like me or to woo you to feel, and that's one quality with doctors, and people don't like doctors for telling the truth. I know some white doctors are fond of giving people time to live. They say, you're going to die in 6 months, you're going to die in 2 months. And they are not sorry about it. When you have multiple huge fibroids, the truth about it is it will be much easier for you if you go for operation, remove it, okay? But if operation for you is a no, 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 then go into this product indefinitely. What you will notice is this. After 3 months, do a scan. The sizes would have reduced, okay? They will continue to reduce. They will continue to reduce, but I cannot give you a time to it. I know someone who had such a very huge fibroid that we're considering surgery for. If that person is feels like sharing her testimony, the person is right on this platform, is listening to me right now. But for the sake of confidentiality, if the person feels like, you know, giving the testimony, the person will do that because the person is listening to me here and is on this call. This person had such a huge fibroid and we're considering surgery. We're not even thinking Selgivity will do that work. But this person consistently took Selgivity independently. And after like 2 years, they went to check, do a scan, and lo and behold, there was no fibroid, no matter how small. None was existing in her. So I wouldn't know if it took that 2 years or it had even resolved before that time she went for the scan. But she consistently took the product. Now, it's not a convenient thing for me to tell you to keep taking something for 2 years, okay? So the truth must be said. If you are willing to go all the way, you're going to get result with your huge fibroid. Thank you.
Yeah, I think we're finished with the questions. It's interesting that, you know, I'm hearing all of this myself because three of us, 3 girls in our family, my eldest sister didn't want to take any of our products, didn't want nothing to do with it. And she ended up having a lot of issues and cancer and had to have a hysterectomy. So, and here I am taking our products, just feeling so young and amazing. And I decided to go down the route of doing something and being proactive, and this is what's helped me tremendously. So anytime I ever meet women who have challenges with their periods or having you know, not being able to have children, I'm always saying, you know, give it a try. At least give it a try for 90 days. And like he said, Dr. Austine said, go back and get another scan. And that's what happened to me. They kept getting smaller and smaller, and then I don't have any issues anymore at all.
So
Sorry,
as we come,
Sean.
sorry, go ahead, Dr. Austine.
When I said there's somebody on this call that has that testimony, I wasn't referring to you, Tammy.
No,
There's
I know.
somebody else.
No, I know, but it's interesting
Okay,
as I'm listening to this, you know, I'm not the
you.
only one out there, so it's interesting, right? And then I see both of my sisters and what they went through, and I end up getting on the product and everything got better. It's interesting now because both of them are on Max products now, both of them.
You know, folks,
Okay,
at the end of the
For
day,
years, after years.
please, Dr. Austine, go ahead.
Sorry, I know we are rounding up now. So just before we close, after our last presentation, somebody gave me a call and said he loved what we presented and he's interested in the business part of it. Now, when I do such things like this, I do not do it for the purpose of the business or the money and all that. But somehow, when you have something good you're sharing with people, there is that part of it that becomes, you know, financial. So if you are interested in knowing how the business runs and all that, you may want to let us know in the course of time, you understand, so that we have a special session where we address how people are making a huge fortune from this opportunity. A patient of mine that I used Selgivity for had a dream that God told that she should go into touching people's life, and that's to do with go through this product. And I think she might be on this call now as I'm talking. So she talked to me about the business and we began to work things out. And I can tell you, within the last 2 weeks, she has made a whole lot of fortune. In fact, she is so amazed, so baffled. So there's this part of business aspect in case you are interested in it. It is. So for this reason, you want to get back to the person who invites you, let them put you through. If I was the one that invited you, you can get back to me. I push you through how you go about it, okay? The business aspect of it. But I don't want to bring business into value because we want to touch lives here. We are concerned about people's health. Thank you.
Thank you very much, Dr. Austine. Thank you, Tammy, for hosting. And folks, again, understand that these products are not designed to cure any disease. But here's one thing, I just want to bring it up again. When you reduce inflammation into the body heals. You talk to any doctor and they will agree with you. Inflammation is the problem that will cause issues in the body. When you increase glutathione production, what happens is inversely, what happens, both are not the same. They're always on the opposite side. So as you increase the glutathione, inflammation goes down. As your glutathione goes down, your inflammation goes up. And that's the reality. And that's why we suggest for you to consider using these products, not just for 1 month, but at least 90 days to get a full assessment and get back to the person who invited you to this session here this evening to get some information. There is 3 centers in Nigeria, one in Lagos, one in Port Harcourt, and the other one in Abuja. And there's different areas. Get back with the person who invited you. If you happen to be in Ghana, if you happen to be in Canada, if you happen to be in the United States, let us know. We will make sure that all your questions are answered. But do get back with the person that invited you here. Dr. Austine, you are such an elegant doctor, and you're a person that is true and honest. And this is one thing I appreciate about you so much. And thank you for assisting us with this wonderful session. And we look forward to our next week's session.
You're welcome, Chris. Thank you so much.
Have a good evening, everybody.
Thank you, Dr. Austine.